Hello, everyone, and welcome to the May meeting of the Global Health Youth Organization. My name is Noraldine, and I'm a co-founder of the organization. We are very excited to see everyone who joined us today. We want to thank everyone for joining the meeting and working around any scheduling or time zone issues that you might have had. As for the format of today's meeting, we will begin with a quick introduction of our speaker, followed by her presentation, and then a question and answer session. After the Q&A section, we will post the shadowing certificate link in the chat, and we ask that all members stay muted throughout the presentation so that we can limit interruptions and distractions. Please feel free to add any questions or comments that may arise in the Zoom chat. I'll now be passing it over to Adam, the other co-founder of the organization, to introduce today's speaker.
Thanks, Nor. Hello, everyone. And as Nor mentioned, I'm a co-founder of the organization. It is so great to see all of you that joined today, and we are so happy that you're able to attend this meeting. We want to once again thank Dr. Yousafzai for taking the time to present today. To quickly provide an introduction, Dr. Yousafzai is an associate professor of global health in the Department of Public Health and Population at the Harvard T.H. Chan School of Public Health. Today, Dr. Yousafzai will primarily be speaking about early childhood and youth developments in global contexts. Please remember to stay muted throughout the duration of the presentation to minimize distractions. Again, if any questions do arise, please type them in the chat and we'll get to answering them at the end of the presentation. With that being said, we will now hand the floor over to Dr. Yousafzai for a presentation. Thank you.
Thank you so much. I'm just going to share my screen. Great. All right, so my presentation today is going to be about parenting interventions to promote early childhood development, which is the primary focus of my research. I work in global contexts, particularly in South Asia and East Africa, trying to better understand the threats to children's development, which primarily includes their cognitive development, their language development, their social emotional development, and their motor development, and how we can address those risks early in life through parenting interventions and other interventions connected with health, nutrition, and children's safety and protection. So in this talk, I'll first begin by providing an overview of the science of early childhood development. I'll then take a case study of my work from Pakistan and describe how through this intervention program implemented in Pakistan, we were able to better understand a strategy to promote children's development in the earliest years of life. And then I'll briefly talk about the issues that remain in parenting programs that we need to unpack through research going forward. So the science of early childhood development. One of the biggest global challenges we face is that there are approximately 250 million children in the first 5 years of life that are off track in terms of their early development. That means them not meeting their cognitive milestones, their language milestones, their social emotional milestones, and their motor milestones. And this matters because these skills established early in life are the foundation on which later life skills as you go through middle childhood and adolescence are developed. So things that we need to learn to be productive, to establish relationships happen in these first few years of life. So when you think about it, you need to be able to have the skills to be able to solve problems, to persist, to remain motivated, to remain focused on situations, to be able to resolve conflicts, to be creative, and to be able to express your emotions, regulate your emotions, and receive your emotions. And so it's critical that alongside children's physical health and children's survival, that we also think in public health and global health about children's development. And one of the reasons that it has received less attention globally is that the first challenge that we had to face internationally was that we had nearly 9 million children in the first 5 years of life dying from preventable illnesses. As we've made progress in reducing infant and young child mortality, we are now paying more attention, not just to whether children are surviving, but under what circumstances they're surviving, what's their quality of life. And this means, of course, we therefore have to pay attention to children's development. So what does the science tell us? We're informed about what works and why it might work for early childhood development from neuroscience, from economics, as well as from health and nutritional sciences. So the first evidence that we have is that we must begin intervention early if we want to change this story, if we want to reduce the number of children around the world who are off track in their development. Why starting early matters? If you look at the story of the brain, the most rapid period of early brain development happens in the first 2 to 3 years of life. So from conception to about 3 years of age. This is where you'll see the pathways being established for language, your cognitive skills, your sensory and your hearing pathways, on top of which more complex pathways get established as we age and as we get older. So you can think about brain development as being driven by our biology, by our genetics. So our genetics provides a blueprint, and it's fairly robust, but it is environment and it is experience that shapes the quality of brain development. So a child that is growing up in a nurturing, protective environment with few risks will have healthier, more optimal brain development. Whereas a child who is growing up with chronic environments of risk that might include malnutrition, that might include neglect, that might include lack of early learning opportunities, that child's development of the brain is less optimal. So we want to intervene early to ensure that the environment and the experiences that shape healthy brain development are positive and are protective and are in place. So why does this matter? If you look along the life course from the earliest moments of life to adulthood, we can see, and shown by the lower red line, that children that are exposed to more risk factors than protective factors have a lower developmental trajectory. So their human development is not as optimal compared to the upper green line, where children that grow up with more protective factors than risk factors are more optimal in their development. We know that if we intervene early, we can start to close that gap. So if we start to address those risk factors that are associated with poverty, that are associated with poor health, that are associated with malnutrition, we can start to close the gap between advantaged and disadvantaged children. So we're reducing inequalities. So the second piece of evidence that's really important about how we intervene is that we're not just focusing our attention on the young child, we're also focusing our attention on the environment of care around that child. And that primarily includes parents, and that definition of parents is going to be flexible depending on the culture where we're working, because it can include grandparents and other key extended family members, but essentially consistent caregivers in the child's life. So it's understandable that if the caregiving is compromised, then how the caregivers provide optimal nutrition, health, developmental care for young children is compromised. One such risk factor is maternal depression. And we know that 15.6% and 19.8% of mothers or women in low and middle income countries are at risk of antenatal depression during pregnancy or postpartum depression after pregnancy. And depression is associated with poor outcomes for the woman herself, including her own health outcomes, her own nutritional outcomes, as well as poor outcomes for her child. So this is associated with poor growth, poor, repeated infections, particularly diarrhea illness, as well as poor cognitive, social, emotional development of the child, as well as poor compliance or adherence to intervention. So if you're trying to change behaviors in a family, if you are not well mentally, if you're not open to those new recommendations or advice, you cannot change your behavior. You first need to address the stresses within the household. You need to address the emotional availability within the caregiver. So it's very important that we don't separate a young child from the caregiver. Secondly, we want to optimize knowledge, attitudes, practices, and skills around care for development. And this is both in terms of direct knowledge and skills about optimal feeding practices, optimal health practices, optimal learning and development support practices. But it also means that health doesn't operate alone. If you're working in communities with high rates of poverty, how do we ensure that households have the resources they need to invest in their families? So this sometimes means health has to partner with social protection or other poverty alleviation strategies. And I think this is critical in recognizing that our approaches need to be holistic. So the health sector plays one role, but it doesn't play that role in isolation. And we need to have two generational programs, right? So programs that can promote access to resources, training, educational opportunities, business opportunities, income opportunities for the caregiver, as well as the direct inputs that you need for the young child, whether that's nutrition, learning, or protection inputs. The third piece of evidence is that, and I've alluded to this already, is that it is not a single input. There's not one intervention that we can say is the silver bullet that will transform children's healthy development, but that these are interventions that need to be connected together. So for example, if a child is living in poverty and is experiencing malnutrition, as well as inadequate learning opportunities, you need to make sure that we package things together in such a way that a child is receiving all of the inputs that they need to thrive. And this is because when we look at studies to say what really harms children's development in those first 5 years of life, the risk factors are biological in nature, they're social in nature, and they're psychological in nature. So these include poverty, nutritional deficiencies, inadequate stimulation or early learning opportunities, depression, and we know much more about maternal depression because we studied it much more. We know less about father's depression or male mental health in general. Family stress, violence, and child maltreatment. So we know that children in low and middle income countries are generally exposed to a greater number of these risks. And we also know that these risks can accumulate and have a severe or more moderate to severe impact on the healthy development of a young child and in them acquiring those learning milestones, those language milestones, those social emotional milestones. So in other words, when we talk about an intervention that promotes children's development, we need to be holistic. So we need to think about the physical health and nutritional inputs for the child, making sure the child has adequate food, that they have adequate treatment if they're sick. We need to make sure that they have early learning opportunities before they begin preschool. Early learning begins at home, and it's the way we learn through play, as well as the way that we socially engage with others, especially the adult caregivers in our environment, our older siblings, because that helps us develop the skills for social relationships. And then we also need to make sure that we have inputs for the family as a whole so that they have the knowledge, the skills, and the resources to be well and to invest in their young children. And finally, we need to make sure that any intervention we implement early in life has boosters later on in life. So while we have risks in those first 5 years, and as I showed you in the figure of the brain development, it's important to intervene early. Healthy development along the life course means that we shouldn't be negating interventions that support good mental health in adolescence and learning opportunities in adolescence as well, when children and young people are exposed to different kinds of risks. And so you can think of these as layers which build upon one another. We need to start early, keep that foundation strong. So whatever you build on that foundation in middle childhood, in adolescence, and in youth is being established on something that is strong. So in summary, taking all of that science, the World Health Organization put together the Nurturing Care Framework, which summarizes that children need health, nutrition, adequate caregiving or responsive caregiving, safety, as well as opportunities for early learning, and that these inputs have to be supported by strong policies, systems, and caregiving capabilities. And parenting interventions are one way of providing those interventions. So in some countries, they might be delivered through nurses, through home visits. In other countries, they might be delivered in clinics when you have well baby visits or immunization visits. It may be coupled with some parenting advice. In other countries, it might be through community health workers, where parents come together in groups to receive additional guidance. But we know that there is good evidence to say that parenting interventions, when building on the strengths of families, when culturally appropriate, and when implemented with high quality, benefit young children. So in that context, I wanted to look at whether this would work in Pakistan, which had, at the time of this study, one of the highest numbers of young children off track in their early development across those first 5 years of life, because of many of the risks that I have described to you, including malnutrition and including a lack of early learning opportunities. I work in the southern part of the country. Even before the pandemic, only 14% of young children 3 to 5 years of age in that particular province have access to early childhood care and education services at home, for example. So we also know that there is persistently high levels of malnutrition in those first 5 years of life. So there is a need for addressing this by reaching parents through the health system. So the aim of the PEDS trial, which is the Pakistan Early Childhood Development Scale-Up Trial, was to evaluate the effectiveness, the feasibility, as well as the cost of interventions to strengthen or promote young children's early child development through the Lady Health Worker Program. So the LHW program is a national program in Pakistan. They are community health workers who do home visits to promote health and well-being in young children and women in rural and remote parts of the country. So we implemented a randomized controlled trial. We enrolled close to 1,500 mothers and their newborns. And because we wanted to test how well this intervention worked, we had a control group which received the basic health services that Lady Health Workers provide. This is basic physical health, basic nutrition recommendations that they provide to all families. So that served as our control group. We then had one group which received responsive stimulation or early learning opportunities, another group which received enhanced nutrition intervention, which includes micronutrient supplementation, and a fourth group which received everything. So they received the basic healthcare services, the responsive stimulation or early learning opportunities, as well as the enhanced nutrition supplementation, which is the micronutrient supplements. And so we trained the Lady Health Workers and we sensitized the community about the intervention. And the Lady Health Workers then delivered this program to each of those 4 groups, either in monthly group meetings or in individual monthly home visits. Their main target was the mother or the female caregivers of the household, but 70% of the time they were targeting or meeting mothers. So they were changing the quality of interaction and the relationship between the mother and the child, guiding the mother about providing early learning opportunities at home. So even before the child went to school, how could you promote their child's capacity to be stimulated, to learn from their environment? Problem solving about basic development care, health care, nutrition care with the mother, and providing social support for the mother. And through this pathway, we felt that it would improve the knowledge, attitudes, and practices, or CAP, of the parents. It would improve their caregiving skills, and it would reduce maternal depression because she would be receiving support. And because of that change in the caregiving environment and the capacity of the caregiver, we would see better opportunities for young children, and this would result in improved outcomes for young children, improved early child development, growth, and health. And parenting programs are only successful if they are going to be seen as relevant in the local community where we're working. So we first, before implementing, we did some formative research to make sure that we were tailoring the advice to build on family strengths and address gaps. We didn't want to be giving advice that was already known and well established in the community. So, for example, part of our formative research is, what do families understand about early development? And this question demonstrates that about 80% of families felt that newborns, infants only started exploring the world through senses like smell, sight, hearing, and touch after 3 months of age, when in fact, children are exploring their environment and they need to be given those opportunities to explore their environment from birth. So that was one recommendation we wanted to ensure was given, that families would start some of these stimulating activities from those first moments of life. Secondly, we asked whether families spoke with their newborn infants, spoke, sang songs, told stories to their newborns. And while about 60%, 61% of families positively responded, there was a significant number, 39%, that said no. And the common reason was, well, children aren't speaking yet. We'll start speaking to them when they are old enough to start speaking. But as developmental experts, we know that young children understand many more words before they express them, either verbally or in other efforts. And so speaking with your child, even as a newborn, is providing that stimulation in early brain development for them to receive and understand communication and start to make sense of the world, to start to build those relationships. We also knew that despite the high levels of poverty, and this is an area with incredibly high levels of poverty, that there was still a lot of strength in these families. So they were able to improvise with the low-cost toys by using everyday items around the house or by making homemade toys. And so we wanted to continue to build on this strength. So the advice that we were going to give was not about spending money, buying new toys that could not be afforded, but using what was in the environment, what was physically around the child, to stimulate the child. So the inputs that we gave was responsive caregiving, which is basically the back and forth between the mother and the child, so that we have high quality interactions, early learning opportunities, and the use of local resources to create those early learning opportunities. And in terms of nutrition, the inputs were multiple micronutrients, nutrition counseling, and feeding with care, feeding as appropriate for the child's age and stage of development. Everything was adapted locally, including the figures. The representation of male caregivers was also shown in the illustrations. So one of the key things that we felt was important in the design of this intervention was that it shouldn't just be about a lecture. A lady health worker shouldn't go into the home or the group meeting and just provide information, because none of us learn simply by being spoken at. We learn by doing, we learn by experimentation. And so the idea was that the lady health worker would go in and give some basic counseling advice, but then the caregivers would have an opportunity to try out those activities with their children, something as simple as peekaboo to singing a song with their child. And the idea was not that the child was going to achieve something through the activity, but that there was an opportunity for this back and forth, for this conversation, expressive, non-expressive, using body language, using facial gestures, to really build the communication between the caregiver and the infant or the young child. And this was to encourage responsive interaction. And we know this is a way for caregivers to be able to understand the signals and the communication efforts of their child and appropriately respond to them. And if you think about it, this is the way that we all learn. When we know that we're being positively responded to, we're going to be encouraged to explore our environment more. We're going to be encouraged to develop further, express ourselves, ask questions. And those seeds are planted in those first few weeks, months, years of life. Every resource we used was low cost, so it was homemade. It was either demonstrated about what could be made at home or utilized. It could have been just metal cups for stacking, for example, things that were readily available within the home. And we also distributed a picture book which used local stories and traditional stories. It had no words because the literacy level in this community is very low. Most of our mothers only had 2 years of primary level education. So this was an easy picture book where you could just point to things, name them, or tell familiar stories through the illustrations. So in addition to those practical activities, there were the meetings that brought the mothers together, or the female caregivers together, focused on different sessions or topics, including what is early childhood development, how to help a mother feel confident and good about caregiving, helping families to understand that children learn not when they start school, but from birth, helping mothers to observe their children's development and understand any red flags if children are off track in their development, to understand the importance of that bond or attachment between mothers and children or caregivers and children, to understand what it means to be responsive, developmentally appropriately responsive to the child, to create a safe environment, to appropriately feed your child, to use gentle and positive discipline rather than harsh discipline, and directly to support mothers who feel stressed. Again, in about a third of our mothers had symptoms or elevated levels of maternal depression. So we needed to also reduce stress, making low-cost toys and understanding the rights of young children. So there was about a short 15 minutes conversation about the topic, followed by the practical session where you tried some activities, followed by some problem solving, and then some social time. Each of the activities included observing how the mother interacts with their child, helping her to ask questions, listen to the child, praise the child, provide advice and guidance, check the mother's understanding, and then help solve problems. So again, it was very interactive. So at the end of this, we delivered this intervention for the first 2 years of a child's life. So what did we find when we went back and we evaluated the impact? We found that children that received the stimulation intervention, whether that was in combination with nutrition or by itself, had better cognition, language, and motor skills. We also saw that feeding practices improved, among caregivers of young children. We saw that child health improved. There was a reduction in child morbidity. We saw an improvement in the mother-to-child interactions, and we saw an improvement in the early learning opportunities provided for young children at home. So this intervention was designed for children under 2 years of life. But what we wanted to find out was if we visited these children again 2 years later at age 4, would the benefits be sustained? And we found again that when we visited the families at age 4, there were better early learning and school readiness scores among the children that received the intervention compared with the control group. There was improved mother-to-child interaction among the children that received the intervention, and continued improved early learning opportunities at home. But there was not all success. We saw that there was no difference to child growth. And one of the reasons I hypothesize is about 2/3 of the households were food insecure. And finally, we also saw that there was no change to maternal mental health. So while we saw these groups come together and the idea was to provide mothers with support, we found that there was still not enough of a reduction of maternal depressive symptoms. So these are 2 areas that we still want to work further on to see how we can package them to improve those outcomes as well. So where do we go from here? The case, or the scientific case, for why we should invest in early childhood development is strong. We know that parenting programs, when designed well, when culturally appropriate, when implemented, can benefit young children and their caregivers. We know that to help that process, understanding local culture, context, and need through formative research to adapt those programs is essential. And we know that we need to concentrate not just on the programs being delivered, but the quality with which they're delivered. But the next generation of parenting programs needs to extend to think about fatherhood engagement. Most of the work that we've done globally has really focused on female caregivers. We need to think about the role of extended families. How can we get more active engagement from or targeting of grandparents, particularly in cultures where they may be key decision makers about what the child eats and how the child is cared for. And how do we address health and healthy family functioning? So things that we didn't tackle included things like domestic violence. But these are all risks that are happening in children's homes. If we don't tackle them, then we're only tackling part of the risks that children are exposed to. I would also say that there are 3 big challenges that are impacting young children for the next generation. One is the impacts of climate change, because this will result in more children on the move. The other is what we're already seeing globally around the world, with children being displaced and on the move because of conflict, an increase in mental health crisis, which is going to impact the caregivers around the child as well as young children's development. And all of these have been compounded by everything that's happened in the last 2 years, where we've seen increases in inequity between disadvantaged children and advantaged children in whichever part of the world we're working in. So I will leave that here, just to say that this work was done when I was based in Pakistan at the Aga Khan University, and it was funded through UNICEF and Grand Challenges Canada. Thank you.
Thank you so much for the presentation. That was extremely informative. So we will now begin the Q&A section. We will first start with the questions that were asked through the registration form, and then we'll get to any questions that were asked in the Zoom chat. This is your opportunity to ask questions, so please ask whatever you have in your mind. So the first question we received through the registration form was, what do you recommend for students who are interested in it? Excuse me 1 second. Sorry about that. So what do you recommend for students who are interested in attending Harvard?
So obviously, any Ivy League school is going to be competitive. But what we look for is, in addition to good grades, it's a kind of a well-rounded individual. So demonstrating your community service, demonstrating initiatives that you've started, all of these things are really important. It could be voluntary work in your neighborhood. It could be leadership programs in your high school. It could be participation in organizations like this, which all demonstrate skills outside of your traditional academic sort of outputs, your academic grades, your GPA. And so I think I can't emphasize enough how important those things are. I would also say that to help your pathway in your application process, it is really good to be able to talk to current students and learn from the experiences of current students. So reaching out through different online groups, or asking to be put in touch with people that might be willing to talk to you, is always going to be helpful, both in terms of thinking through the parameters of your application, thinking through what an interview process could look like. Being able to speak with the current students is critical, I think, and very, very helpful in that process.
Thank you so much for that response. And the next question we have is, what is one of the aspects that you most like about working in public health?
I think for me, it is such a diverse field, and it's an applied field. And so, for example, I work in the Department of Global Health and Population. My own training is in international child health and development, and I work alongside economists, ethicists, experts in health systems, demographers. I like the multidisciplinary nature of the department, because I believe that to address some of the biggest challenges that are going to be impacting our health and our functioning and our well-being in the coming years really requires a range of people to come together, to be really thinking about innovations and solutions that are out of the box. And so that's the first thing I like. The second is I really see it as an opportunity to fundamentally address inequalities in society. I think that, in the last 2 years, for example, we saw that politicians and leaders around the world were making choices between what was right for people's health and what was right for the economy of a nation during the pandemic. But time and time again, we learned that unless you're prioritizing people's health, any short-term gains in the economy are just that, they're short-term gains. We need to ensure that that we are addressing the inequities in health. And I think that's in order for societies, for communities to thrive. And finally, I also really see that health is public health, and this idea that we're just focusing on health is really a small part of what we do, that we're also thinking about how we do this in partnership with education programs, how we do this in partnership with social protection programs. I see it as something that's very cross-sectoral. And I think all of these things stimulate me, excite me, and keep me engaged in the field.
Great. Thank you so much for that response. So our next question, still sticking with the registration form, is how was your experience working at the Aga Khan University?
I think in terms of, so just a little bit of context about myself. I grew up in the UK. I trained in the UK. My PhD was from University College London. But after my PhD, I decided that I wanted to understand global health by living and working in the country and learning from communities themselves. So not just going to Pakistan, but having the opportunity to really implement things on the ground and to learn from the communities that these interventions are designed for. So spending time in the rural communities where much of my work is implemented. So for me, I think that the opportunity to be able to travel, to be able to live and work in the communities that you want to see change in is really critical. So even if you are, for example, if you're in the US, so much of our knowledge about public health comes from urban centers, and such little of it really comes from rural US. So if we really want to make a difference even here, we need to think about building the better community-based partnerships in rural communities. And so for me, the experience of working with the Aga Khan University allowed me to do that in the specific country that I was interested in working in. It allowed me to build those community relationships and to think about the challenges, the questions, and the solutions from that perspective.
That was a super insightful response. Thank you so much. Our next question is, what fascinates you about health or medicine in general?
I think it's that we see these, I think I've always loved research. I've always loved the idea that there are these challenges that we need to address. But I think there's also this, fundamentally, health is a basic human right. And I am often very sad and often very angry that this basic fundamental human right is not something that we see delivered for every single person in the world. And I think that's what drives me in this field. That's what excites me and motivates me, that we need to ensure this fundamental right is there for everyone, and that it's the same quality, and that these inequities that are systemic are tackled. And so that's what keeps me in the field of global health, and will continue to keep me in this field for many years to come.
Thank you so much for that response. So the next question we have here through the registration form was, what was your experience and or advice applying for college as an international student?
So I personally haven't been an international student, but as a faculty that reviews applications for international students that want to study in the US, I think it's always good to learn from the experiences of others in your own environment that have gone through that process. So what is the best lessons that they have to help you make the best application? I think it very much goes back to the first response that I gave as well. Reaching out to current international students on campuses in the institutions that you're interested in applying to is also very, very helpful. And having people review your application and practice those interviews in the cases where you are being interviewed, because I think it's often a whole different culture, and it's useful to get that practice in and those reviews in from the people that are on campus that have gone through that experience. And don't hesitate or be shy about reaching out with questions to other students, to the international, to the applications department, to faculty that are often willing to be able to support you and help you and give you basic recommendations, resources, advice.
Thank you for sharing your perspective on that question. And our final question from the registration form, that's very broad. It's like, what were some of your favorite experiences throughout your career?
So I've had, I think ultimately the best experiences I've had is when I'm in the field site and I'm working with the local community team as we're implementing the intervention, as we're designing the building blocks of that intervention together, as we're training the frontline workers to deliver our interventions, as we're struggling together to solve the problems that inevitably come up when you're implementing research. I think it ultimately is about feeling very fortunate to have worked with such a diverse group of people and to have been able to travel and work in such diverse communities and ultimately learn from each and every one of those experiences. It's very humbling to realize that you'll never have all the answers and that there are so many strengths that you have to build on and learn from constantly. And if you have that lens in mind, if you look at that sort of sense of equity with which you approach your work, I think you'll always build healthy, happy professional relationships and collaborations. And hopefully, because of that, you'll be able to come up with creative and innovative solutions that are worth testing in different parts of the world and have implications for learning across the world globally.
Great, thank you so much for that response. So those are all the questions that were asked through the registration form. Now we're going to go to the questions that were asked in the Zoom chat. So if you still do have any questions, please ask them. So the first question that we received is, what interested you in early childhood development?
I think it's simply because so many of the outcomes we see in human development in our adult life are rooted in how we grew up, where we grew up, the circumstances in which we grew up. And there is so much opportunity to change that story early on, that if we build a strong foundation, we can change the way people have experiences and learning opportunities as they go through school. We can change the opportunities for young children. I think it's simply that you can change a story at the start. That doesn't mean that we don't build on that. As I've said, when you go to the adolescent period or to the youth period, but that foundation for me is critical for creating a different story for life outcomes. So much of our physical health outcomes, our mental health outcomes are rooted in our early life opportunities, our early life risks. And so to be able to change that early on is really what drives me in early childhood development.
Thank you so much. And the next question that we have is, what is your advice for students who would be attending Aga Khan University?
So congratulations if you're about to start at the AKU. You will be in an incredible environment. It's a beautiful campus and you're surrounded by faculty that are dedicated to your learning, who have rich expertise in their specialties and optimal teaching and training methods, and you're surrounded by a really active student body. So my advice would be to really get engaged with all of the opportunities, the student clubs, the additional learning opportunities that you have to work with other faculty as you go through the program. both on campus and in the community outreach programs, because I think that will give you the fully rounded experience that AKU has to offer. AKU is an international campus, and so whether you're based in Karachi, you'll also have the opportunity to, as you go through the program, to learn from the many people that pass through, that might be from the Nairobi campus, that might be from elsewhere, and so to make the most of those learning opportunities. And we know that AKU grads are really contributing around the world, in addition to the work that they do in Pakistan and in Kenya.
Thank you so much for that response. And the last question that we received through the Zoom meeting was, how do you get some basic understanding of public health systems as a pre-med student?
So I think there are more and more universities offer courses, sort of introductory courses to public health or global health. I think another opportunity is to see if you can reach out to faculty, if there are research or summer opportunities to work with faculty who are in public health on summer projects or winter projects. I think it's the richest experience you can get, and the most hands-on experience you can get as a pre-med.
And those were all our questions. So thank you so much for all those great answers. And once again, I'd like to thank Dr. Yousafzai for taking her time today to give us an introduction to her work. Thank you all for attending today's presentation, and please use the link posted in chat to obtain your shadowing certificate. Thank you all so much for attending, and we look forward to seeing you at our next meeting. And we're going to stick around for a couple of minutes to make sure everyone has access to the link.
Thank you so much. It was such a pleasure to join you all.